There are many different causes of swelling or edema in the legs and the feet. These include vein disease, lymphatic disease, inflammation due to injury or infection, as well as heart disease, kidney disease, and fluid retention from certain medications. The most common cause of lower leg swelling is disease of the veins known as venous insufficiency. The veins are part of the circulatory system that return unoxygenated blood back to the heart from the entire body. In the legs, the blood has to travel against gravity to get out of the legs on the way back to the heart. This is possible due to the presence of one-way valves in the veins that stop the backflow of blood into the legs and the feet. Some people have faulty valves that do not function properly, and as a result, blood pools in the veins of the feet and the legs, giving rise to varicose veins. Eventually, the fluid leaks out of the veins into the soft tissues of the legs, producing swelling, darkness, dryness of the skin, and occasionally ulcer formation on the legs. The best way to deal with swelling from venous insufficiency is to wear elastic stockings during the entire day and take them off before going to bed. In severe cases, the vein may need to be closed off by use of different techniques or may need to be surgically excised. Another problem with veins that can lead to painful swelling of the legs is a blood clot formation. When the clot happens in the superficial vein, there is some redness, swelling, and pain along the area of the blocked vein. This is simply managed with moist heat application and taking aspirin for a week. A more serious condition takes place if the blockage happens in the deep veins of the leg. This is called a DVT, which stands for deep vein thrombosis. This produces significant pain in the calf along with swelling and redness. A DVT requires immediate hospitalization and treatment since the deep clots have a potential to break off and travel to lungs, resulting in blockage of lung circulation and causing death. Just like problems with the venous system, there could be blockages in the lymphatic system, which can result in swelling of the legs and the feet. The lymphatic system consists of lymph nodes and lymph vessels which carry fluid that has leaked out of blood vessels back into the general circulation. When either the lymph vessels or lymph nodes become blocked or damaged, or removed as in case of lymph node biopsy, then the fluid will remain trapped in the legs. This can lead to severe swelling of the legs and feet, along with wrinkling and oozing of fluid from the skin. Specialized treatment with compression bandages and devices is necessary to keep this type of foot and leg swelling under control. Another common cause of foot and leg swelling is simply inflammation from either an injury or an infection, which results in increased blood flow to the affected area, resulting in edema. In case of injury, rest, ice, elevation, and compression helps with decreasing the swelling. For infections, swelling improves as the infection is treated with oral or IV antibiotics, and in severe cases, surgical treatment may be needed to drain abscesses. Another cause of leg swelling includes organ disease and certain medications. Heart disease, such as congestive heart failure, can cause leg swelling as one of its symptoms. Kidney disease or kidney failure can also produce leg swelling. Treatment revolves around controlling the underlying disease. Moreover, certain medications can give leg swelling as their side effects. These include blood pressure pills, diabetic medications, and pain medications. So if you have swelling in your legs and feet, you should schedule a medical evaluation. We provide a full array of diagnostic exams in our office to determine the potential causes of your lower extremity swelling, and if needed, we will refer you to the appropriate doctor for the complete management of your conditions.